Dr. Vikki Petersen here. I wanted to speak to you today about artificial sweeteners. In my area of clinical nutrition, we've known the dangers of artificial sweeteners for a very long time. Unfortunately, though, we haven't done the best job of letting society know about it. Now, there is some diminishment in the consumption of sodas, which is good. That's where a lot of artificial sweeteners are located. But of course, we have those little packets of the various sweeteners that are artificial that you see in restaurants and coffee shops, etc., and they're still very much present. So I want to talk to you about a couple specifically. One, aspartame. And of course, when people, if you ask them why they're consuming artificial sweeteners, they say, well, I like the sweet, there's no calories, so it'll help me lose weight, or it'll prevent weight gain. Actually, nothing could be farther from the truth. Those who consume artificial sweeteners actually double their risk for obesity. Now, why is that when there's no calories? The body can't be fooled. So when it ingests something that's very sweet, there's two different things that happen. One is research shows that there's actually a calorie counter in the brain. So when you ingest something sweet and there's no calories, the body actually craves. It wants to make up for those missing calories. So you'll consume more. You'll crave more simple carbohydrates, other forms of sweets, and also these artificial sweeteners increase fat storage. So they're not doing from that perspective at all what you would expect them to do. And this is not just aspartame. This is all the artificial sweeteners. By the way, aspartame goes by several different names: Nutraswwet, Equal, something called Spoonful, and there's about 4 others. The manufacturers know that people are starting to hear about some of the concerning aspects of their product, so they keep changing the name. So it's important that you know the various names or aliases that it goes by. Another thing that I recently learned is that aspartame is actually a GMO product, meaning it's genetically modified. It's actually produced from a bacteria, E. coli, that is genetically modified. Now, why didn't we know about this? It falls within a loophole because by the time the product is done, there's no E. coli left in it. So Monsanto, who produces it and who is kind of the king of GMO, does not need to declare that aspartame is a GMO product. So that's something that you really need to consider, and honestly, none of these should cross your lips, or please your children. You're an adult if you get the knowledge and you can decide to do whatever you want with your body, but our children don't really know any better, and if you can educate them and just not have it around them and not offer it to them, their health will be much safer. Now, Splenda is another product. You'll hear that it's very natural. That's not true either. It's made from chlorine, and of course, chlorine molecules found in salt, sodium chloride. However, what's artificial about the way the chlorine is bonded together, the molecules, is that there are natural bonds. So a natural product that has chlorine in it, that's grown on the planet, those chlorine bonds are such that they get digested and broken down very easily when they go into our digestive system. In Splenda, the bonds are different. They're not a natural bond. As a matter of fact, it's the same bond found in PCBs, DDT, Agent Orange, and yes, all of those are known carcinogens. So this is a very different bond. It's not a natural one found in Splenda. As far as, there's been very, very little research done on Splenda, absolutely no long-term research, but as far as people calling in and complaining about things, broad range of complaints that people mention, from headaches and rashes and heart palpitations and joint pain, all occurring within 24 hours of eating it. So these are not good products. They truly are dangerous, and they should be no part in your diet or your family's diet, or, as I said, please not your children's diet. So do a little research. It's out there. I know it can be confusing because you hear the ads, it's just like sugar and it's natural. Well, it's not. okay? And there's a lot of information on the internet that does tell the truth. You can do a little more research yourself. Most of the studies, unfortunately, that found them to be fine were actually funded by the industry itself, so not exactly an unbiased view. And I feel very strongly about this, and I just wanted to do my part in getting the information out there. So I hope you found this helpful. Please let me know your thoughts, and until next time, I wish you very good health.